Hi everybody on YouTube. My name is Linda Morse and I'm an acupuncturist. I've been teaching board review for 16 years and it's great and I love teaching. And what I want to share with you today is ways to answer test questions, because I really feel like when you learn how to answer test questions, your scores can go from 65% to 90%. It's people not knowing how to answer test questions that's really affecting their grades and affecting them passing their test. So this is what we're going to do now. So here are some questions for you. Good. So number one here. Remember, the first thing that you're going to look at with any case is the last sentence on what they're asking you. So what is your diagnosis? The reason that you do that is because sometimes you'll get test questions that'll say, what is the original problem, or what is the problem right now? Okay, so what is your diagnosis? All right, we looked at that. Now let's go back. Is there a tongue or pulse? There is a tongue that's pale, but it has slightly red sides. So let's look at the answers. Is there anything that we could throw out based on that? So we're looking at answer A. I would probably throw out answer A because I don't think you'd have slightly red sides with answer A. I would probably keep B, C, and D. And then you'd have to go back and read the case. Now, when you go back and read the case, I know that if you're taking your nationals exam, they give you a little, whiteboard that you can erase. Maybe you want to put the symptoms on there. So the first one, she has premenstrual tension, which tells me that we probably want liver qi stagnation in the answer. So I'm thinking I might eliminate C. Before her period, she's depressed and anxious. Her periods are painful. The menses blood has some small dark clots, and she feels very cold. Other symptoms are cold. So now I know that I want to get rid of C because I know that C doesn't have any cold in it. And I'm actually probably not wanting D either because I want an answer that has cold. Either it says cold or it has yang deficiency. So I see achy knees and I see cold feeling. So I'd like to have something with the kidney. So this tells me that the answer is answer B with kidney yang deficiency. All right, so again, we looked at the last sentence. Then we looked at the tongue that was pale with slightly red sides. Then we got rid of A based on that because yang deficiency and liver blood deficiency wouldn't have red sides. As we started to read and we started seeing cold, we decided that we didn't want C and we don't want D because neither of those has the word cold or has yang deficiency. Okay, so that's your answer to number one. Your answer is B as in boy. Answer two, actually, question two also goes with this. What is your treatment principle? Obviously, if you have yang, let's just say you didn't even have the first set of questions. If you went right to treatment principle, you'd be looking for something that has cold in the answer. And it looks to me like the only one that has cold would be C. So even if you didn't have these little questions above, the spleen and kidney yang deficiency, if they had just said to you, what is your treatment principle, you should have been easily led to answer C. All right, let's look at number three. The last sentence, what is your diagnosis? He has a red tongue with red sides and a dry yellow coating. So red tongue with red sides. I am probably wanting to get rid of liver yang rising because liver yang rising does not have a dry yellow coating. Liver yang rising has a red tongue, probably no coating, but it sometimes doesn't say. So I'm throwing out answer A. All right. Now, I really don't believe it's going to be a dry yellow coating with extreme heat, but just for your benefit, let's keep those 3 in there. And let's go back to the beginning where it says that a patient is yelling at the top of his lungs because he can't find a parking spot. That sounds familiar in LA. You notice that his eyes were red and his face is bright red. You had some cookies and asked him if he wanted one, and he said, I can't because I have a bitter taste in my mouth. Okay. As he's filling out his forms, you notice that he has a slight tremor while he's writing. So you know it's not extreme heat generating wind because there's no high fever. And if you know your syndrome, always flip it. What is the syndrome extreme heat generates fire? It's for high fever and tremors. There's no high fever, so answer B is out. You're choosing between answer C, which is liver fire, and answer D, which is liver fire generating wind. So the minute you see tremors, you're moved to answer D, okay? And that's how you'd approach that question. All right, now with question number 4, we're going to points. And I always believe there's 2 ways that you can approach this. One is whenever you have points, you should always look for the diagnosis. What is your diagnosis? But you may not have to do that first. What I would do first is look at the last question. What is the best point selection for this patient? All right, so they're looking for point location. What does he have, a tongue and a pulse? He has a bluish purple tongue and a choppy pulse. Now, even though there may not be tongue and pulse questions on your acupuncture module, my advice to you would be to go back and re-look at your tongues and pulses, okay? Because I think it's imperative and it helps you quite a bit. For instance, we have a bluish purple tongue and a choppy pulse. Choppy pulse is going to be either blood deficiency, blood stagnation. So I'd like to look at the points. I have to look at something that's going to help me with stagnation. I'm looking at number 1, and I see liver 3, and that could help. So I'm really not going to throw that out. And you need something that is not all deficiency points. Number 2, maybe I'll leave in number 2. Number 3 with Ren 6, spleen 6, Ren 12, stomach 36, do 20. I'm really not going to use that because it's all for somebody that has deficiency. And with that tongue and pulse, that's not the answer. So I'm going to put a little cross next to C. With D, I know that stomach 29 is called a return amenorrhea. Spleen 10 is blood. I still have liver 3, Li4. So maybe I'll go back and read the case. You know, I don't like C. You know, I'm gonna look at the case. The woman has pain in the lower abdomen, and it usually starts before menses. Pain. Pain tells me that this syndrome is dysmenorrhea. Okay? Dysmenorrhea, because whenever they talk about pain with menses, you have to think dysmenorrhea. Now, I know that dysmenorrhea, according to Chinese Moxa acupuncture, Kiam, is 2 syndromes. One is excess and one is deficiency. So I'm looking at this, and because it's dark purple menses with clots, I'm thinking this is excess. I do know that one of the points for excess is UB32. UB32 is the empirical point for dysmenorrhea, but only for the excess syndrome. Do I have this point anywhere? Yes, I have it in the answer A. I also, because she has pain, I'm looking for spleen 8. So with that in mind, and because it's not amenorrhea, I'm throwing out answer D. Okay? Now, I kept B because it had spleen 8, but it doesn't have UB32. And most of these points here are for deficiency, so I'm really not going to use B. And I'm happy with my answer A, which has UB32, the empirical point, has spleen 8, has liver 3, so it's moving. We've got dark purple clots. Now, if you're a person that knew your syndromes really well, and when you see the dark purple clots with the pain, you could say, hey, that's dysmenorrhea and I know the points. You could jump right to the points. Okay, so the answer for number 4 is A. Okay, so let's look at number 5. With number 5, we're looking at what is the most appropriate acupuncture point combination to treat the patient with. He says he's had these symptoms for 1 week. Is there a tongue and pulse? It says that he has a yellow, greasy tongue coating and a slippery, rapid pulse. Now, because he's saying greasy and slippery, I know that the answer that I choose has to have some points for damp. So I'm looking for something that's going to handle damp. It's also yellow greasy, so maybe something for heat. So I'm going to look at these. Now D is throwing me off a little bit because it says A and B are both the best treatments. All right. So let's look. I probably wouldn't choose A all by itself because there is no points for damp. There is DO14, which clears heat. I'm looking at answer B, which has Ding Xuan, which is a really good point, lung 5 and stomach 40. I really like that. So I'm definitely interested in B. In answer C, I have some tonification points and chronic lung qi points and the Yuan source point of the lung, but I don't really have anything for the damp. So I have to throw out C. So my question is, am I going to use A and B, or am I just going to use answer B or answer A? I don't think I would just choose A. So we're going to go back and look, and he has a long case of bronchial asthma with coarse breathing, chest congestion, proximal coughing spells. The sputum is yellow and so sticky that he wants to expectorate. So physical examination reveals his yellow greasy tongue coating, which we already talked about. And so are we going to choose answer A and answer B? Or are we just going to choose answer B? And I would say that the best choice is answer B as in boy, not A. We don't really want lung 7. We don't want UB12 because it's not short term. Okay? So the answer to number 5 is B as in boy. Hi. So, did that blow your mind? Well, it was great fun, wasn't it? Okay, so if you want more information, happy to help you with any of your exams. Check out my website, acupuncturereviewclasses.com. Please feel free to contact me. I'm all about helping students. It's personal with me. I want to see you pass your exams.